Thank you very much. Good evening to the members here at the Pegasus Hotel. We have a fairly good sized crowd of dentists and I don't know if you call them oral hygienists or oral hygiene engineers. Dr. McKenzie, you can help me with that later on. I also want to just welcome those online. My colleague, Minister Terry Long, who is supposed to be online, who will bring greetings momentarily. But of course, most importantly, our diaspora members who are situated far and wide across the seas and across the lands. Really happy to be here with you. October is Oral Health Month, and this is a discussion around oral health, particularly around the partnerships that are necessary, that have been taking place, that we value, and how we can improve that partnership. Before I ask the minister to come in, this is Minister Terry Long, who has responsibility for foreign affairs, foreign trade, and in particular the relations with the diaspora. Let me just welcome the other three gentlemen who are here on the platform with me. We have to my extreme left someone who needs no introduction among the oral health team, Dr. Irvin McKenzie, Chief Dental Officer. He works, of course, out of the Ministry of Health and Wellness, and he basically manages the program around oral health, the public system, and he will speak shortly. Then we have beside him, we have Mr. Joseph Wright, Executive Director, Great Shape, and he will speak a little about what Great Shape is doing. Great Shape is a great partner for us. Great Shape, great partner, okay, and has been doing a lot of work in the space as part of the outreach, which we appreciate and we continue to encourage. And then to my immediate right is Mr. Courtney Cephas, Chief Executive Officer, National Enhancing Healthcare Foundation, which is the foundation in the Ministry of Health and Wellness, which is a very critical part of facilitating our diaspora community. So you'll hear from all of them and you'll get a chance to ask your questions. I am yours truly, Chris Tufton, and I'm sure you'll have a few questions for me, and I'm sure maybe a few criticisms too, which we welcome. All right, so before we go further, I want to just recognize again my friend, my colleague minister, the Honorable Orlando Terry Long, MP, State Minister, Minister of Foreign Affairs and Foreign Trade, as we have this discussion around oral health. It is Oral Health Month, and we believe that taking care of your oral health is part of taking care of your well-being and wellness. Minister Terry Long, over to you, sir.
Dr. Tufton. And again, let me just say that today was one of those interesting days when, our country has managed to survive, yet another earthquake, 5.4, 5.6, based on the different readings that I've received so far. But again, certainly I had to ensure that, matters across the constituency, our elderly, our shut-ins, even though structurally they are fine, but the sort of emotional scare that would have been attendant upon this matter. So we had to take care of those things. Again, so that's why I'm joining you virtually here. But again, one of the things that Dr. Tufton and his team at the ministry ensured is that as a government, working together with all our partners and stakeholders, is that we welcome the era of technology when we can be physically present without being physically present. So Dr. Tufton, to you and to the panelists and to all those persons across the diaspora, who have joined online, and to those persons who made it down to the Pegasus, good evening to you all. I certainly must acknowledge the work that you have done, accompanied by your senior health officials in the ministry. You certainly have been dedicated, over the last several years, in particular, guiding the country through the COVID pandemic. To our dedicated cadre of diplomats overseas, you, the members in the diaspora, all our dentists and doctors and those of you who have given your service, I must say, good evening to you all as well. Additionally, members of the Global Jamaica Diaspora Council and the Global Jamaica Diaspora Youth Council, good evening to you all. Members of the civil society, academia, and of course, across the private sector, fellow Jamaicans, one and all, it is a pleasure to be here. Certainly, I join my colleague minister in extending heartfelt greetings to our Jamaican family across the globe as we celebrate, Oral Hygiene Month, and certainly by having this important virtual town hall organized by Dr. Tufton and his team at the ministry. Notwithstanding the earthquake, here we are because of the importance of what oral health means to us as a society. This evening, our community takes a critical look at an often overlooked but undeniably essential aspect of health or oral health. Seeing so many smiling faces on the screen, there's certainly no doubt in my mind that this evening's theme, Be Proud of Your Mouth for a Lifetime of Smiles, resonates with us all. According to the United Nations Sustainable Development Solutions Network's 2023 World Happiness Report, Jamaica was the highest ranking Caribbean country on the Happiness Index. Our oral health and smile are therefore, at the very least, perceived as one of the most immediate visual indicators of outward and external happiness, and even more importantly, a sign for assessing risk levels associated with some non-communicable diseases, as well as depression. This month's focus on oral health, therefore, carries a special significance, not only as a timely reminder for maintaining excellent dental hygiene, but also as an opportunity for forging meaningful partnerships in healthcare with an emphasis on oral health as the cornerstone. In so doing, we can make a lasting impact on the oral health of our citizens, both at home and abroad, through purpose-driven collaborative efforts such as Oral Health Mission and other health-based projects. It is with the foregoing in mind that I commend the Ministry of Health and Wellness for arranging this opportune engagement with our Jamaican family, both at home and abroad, as our strategic partners for collective growth and development. Having witnessed firsthand the remarkable efforts of our Jamaican family, I wish to commend the many government officials, private sector members, community leaders in the diaspora, and the numerous stakeholders who have contributed immensely to the crystallization of numerous partnerships which continue to bolster our development efforts. This evening's Diaspora Town Hall will undoubtedly, therefore, sustain this important tradition. Together, we are certainly moving the needle towards a brighter future where our lifetime of smiles can be a shared reality for all Jamaicans. It is on that basis that I am confident about our collective and energized engagement for the upcoming 10th Biennial Jamaica Diaspora Conference, affectionately known as the Big Ten. This signature diasporic event is being organized as a whole of Jamaica family affair centered on the theme of empowerment, wealth creation, and youth. In this regard, I urge all Jamaicans to mark your calendars for Diaspora Day, which we will celebrate on the 16th of June, Dr. Tufton, 2024, as the date around which the conference will be held. By way of update, the Ministry of Foreign Affairs and Foreign Trade continues to work on pairing the Global Jamaica Diaspora Council and the Youth Council sector leaders with focal points across several ministries, departments, and agencies as we work together to plan towards Jamaica Vision 2030, leaving no one behind. And certainly in respect of health, we will continue that tradition of leaving no one behind. We didn't leave anyone behind during the COVID pandemic. We will not leave anyone behind as we celebrate Oral Hygiene Month, and certainly we will leave no one behind next year as we celebrate the 10th Biennial Diaspora Conference. With that in mind, I call upon our diaspora members in the USA, Latin America, and the Caribbean, as well as the Asia Pacific, to attend the conference either in person or virtually, again, given the new paradigm of technology and how we relate in terms of being physically present, even by virtual means. Therefore, my fellow Jamaicans, I want us to be cognizant that the government of Jamaica continues to be receptive and guided by the feedback of the diaspora in terms of its different issues affecting our homeland. We understand that even though you are far away from Jamaica, that you continue to make a valuable contribution. Certainly as Member of Parliament for East Central St. Catherine, I have had the pleasure of working with diaspora organizations in doing health fairs. Whenever we have our back to school health fairs, or even back to school health fairs as well, there's always a contribution from members across the diaspora. Your donations have been recorded in the millions of US dollars, goods and services coming all the way from England, Canada, America, and of course, oftentimes across from Europe. So I want to thank you all for your continued support of Jamaica. As I indicated in the opening, you are all ambassadors of Brand Jamaica. We want to maintain this strong tradition to continue to engage with our diaspora, to empower you so that you can continue to make a difference in your communities and also in our communities right here in Jamaica. So thank you all for all the proactive steps that you have been taken. I want to wish you all the very best for this evening's forum. And again, in terms of your broader efforts and initiatives to maintaining and advancing that sort of Jamaica where we can all benefit, where no one can be left behind. And certainly we can light up the world with our bright and beautiful smiles in the tradition of good oral health and hygiene. Thank you all.
Thank you very much, Minister. Appreciate the welcome. And we certainly look forward to continuing the dialogue as it relates to the diaspora in a more broad-based way. I do think that many persons may be wondering how we are as a result of today's earthquake, and I just want to say that we're alive and well. No fatalities, thank God. Some trauma, some uncertainty and fear, which is expected, and some structural damages which are now being assessed. But I think the worst has not happened, and I think we're better for it. So we give God thanks for that. And I'm sure you would reach out to your relatives and friends here in the diaspora and would get more particulars around how traumatic it was. All right, so I want to go right into it, and because we want to give you an opportunity to respond and to ask questions. So I'm going to start with Dr. Mackenzie, our Chief Dental Officer. He's going to make a very short presentation, emphasis on short, but hopefully in doing so, give you an overview as to what the oral health team here does and how we collaborate, and then we take it from there. Dr. Mackenzie.
Thank you very much, Minister Tufton. And I must also say thank you very much, Minister Terlong. I didn't know you were such a great advocate of oral health. And of course, to my fellow colleagues and partner here on the podium, and my Jamaican dental surgeons and other team members that are here. And I'd like to also send greetings to many members of the diaspora that we have worked with over the years to bring good quality oral health services to the people of Jamaica. And in cognizant also of what happened today, I just like to put my part and say, as a man of faith, to God be the glory, and we are indeed very grateful that we are still here and enjoying life. Just to give you a quick overview of the National Oral Health Program. Yes, October is Oral Health Month. Not just Oral Health Month, but the government has made it the National Oral Health Month. And it has therefore elevated oral health to a place of pride that we can all be proud of. So we are talking about being proud of your mouth for a lifetime of smiles, because we truly believe that nothing else epitomizes good health like good oral health, especially when you go and see the average boy and girl in the street. That smiles, Minister, says a lot. You know, it says more than a blood pressure check. And it's like knowing your numbers when you have all your 32. So in looking at our national picture, our beautiful island is what have endeared many to come to our shores year after year. The beautiful mountains, as one song said, from riverside to mountains, from Canefield to the seas, our hearts salute Jamaica. And Jamaica is really a place to be. And Vision 2030 embodies everything about Jamaica, that Jamaica should really be the place that we want to live, do business, and have our family. And oral health is basically in tune with that. In looking at the bigger picture, Jamaica is also a cog in the wheel that is a global wheel. 3.5 billion people suffer from the ravages of dental diseases. And Jamaica is no different. Oral health conditions still remain the most prevalent disease condition affecting humankind. In looking at the burden of oral diseases, and this minister just came out Thursday by the WHO on the Global Oral Health Status Report that actually shows that when you look at children in Jamaica between the ages of 1 to 9, the prevalence of untreated decay is about 45%. And permanent teeth in individual 5 years and over, because you start having your permanent teeth around the age of 5, is 30.1. Gum disease, which is also a very prevalent dental disease that many of you in the diaspora knows a lot about, is 22.7%, and a dentalessness, no teeth or toothlessness, 7.7%. And this basically helped to form our agenda. What we know most of all is that most oral diseases are preventable. And that's why we here today, my colleagues and those of you in the diaspora, along with the Minister of Health, we have a passion for prevention because we do believe that most oral diseases are preventable. When we look also at the risk factors, we're just sharing today that, Minister, you've been talking a lot about sugar. And sugar is really serious business because the total amount of sugar that an average woman really needs per day is 24 grams. I'm talking about added sugar. And for men, 36 grams. Jamaicans, and those of you in the diaspora knows this very well, we consume 134.8 grams. You know, there's something about sweet tooth. I thought being a dentist was about having a sweet tooth. But the sweet tooth is really not the way to go. And the Ministry of Health has actually had an excellent policy, a food policy, promoting good health. And we in oral health are no different because we don't have a silo approach to health. Oral health is integrated in the broader health picture. So we're looking at sugar, we're looking at many other things in this regard. So 134.8 grams of sugar, there's about 34 teaspoons of sugar. And that is really, really very bad. So during Oral Health Month, Minister, we've been talking about that our health is too sweet to mistreat. Lose the sugar, eh? That's the tweet. So it's a no for us. So you in the diaspora, we're celebrating every Tuesday in October as a no sugar day. And Thursday, you can join us because every Thursday, Minister, we're going to have no sugar days on Thursday, on Wednesdays in November, and in December, every Thursday. So we want to say that because sugar and poor oral hygiene is the major cause of dental diseases in Jamaica. Our good professor from the University of the West Indies, Professor Hilary Beckles, recently, he said, from days of the sugar plantation, Minister, is that this thing has followed us into the 21st century. From the plantation, we had a lot of salt barrel things, like saltfish and sugar cane, and it become our top problem now. Diabetes from the sugar, hypertension from the salt because of the intolerance. So you see, everything is really connected, and we are putting them out back into the body. And there are so many other statistics that we can share. But what are we doing in Jamaica? Today, the Ministry of Health has moved away from just having one program in oral health to having 7 programs. 7 programs, a testimony to a great effort. We have moved from having 40 dentists in the public services to about 86 dental surgeons. Moved from having no regional dental surgeon to about having 3 regional health authority having dental surgeons. We're going a far way. We have a community-based program, and in our community-based program, our flagship program now is the, guess what? Second Chance Smile. So you in the diaspora, we are trying to encourage you to come on board because right now we have a target of seeing 10,000 patients over 18 months. And what we're doing, we're not just focusing on providing emergency relief like extractions. We're trying to make sure that extraction is the last thing we do. So we're emphasizing prevention, conservation, and where it is impossible, then we just have to do the extraction. But we're doing more than that. We want to rehabilitate the patient. So with your effort and your collaboration, we can move it, Minister, to say from 10,000 to 20,000 with your help. And we know we can do it because we feel the diaspora and we know what that help means. Our school-based program has been refocused and we're pushing a new policy on school health because we are partnering with the nutritionists in the Ministry of Health and all the Know Your Numbers team because health is one, and we are reconnecting the mouth to the body. We're talking about all health. Oral health is part of general health and well-being. For special needs, we look into the diaspora and to others in terms of our help to focus on those children with autism, those children with cerebral palsy, attention, hyperactivity disorder, etc. And usually those are cohorts of individuals that you guys know that are placed in homes that nobody sees. And we have a heart and we want to make sure that we can reach these persons because the chain is strongest at its weakest link. In terms of hospital-based dentistry, we are pushing for a policy to make sure that we have dentistry in the ambulatory areas, that people can get dental care if you need to be put to sleep or anything, that we can get that care within the hospital. In looking at the advanced integrated program, which is a new kid on the block, we are looking at maternal and child health. Right now in Jamaica, we are one of the leaders in the world in offering oral health care to every mother. For every pregnant woman and adolescent girls, we have a program to screen them, to give you education, and to provide the needed dental care that you require. For the diabetics, we're screening our diabetics, giving health education, monitoring for periodontal disease, because you cannot control that glycemic index without good oral health. About those children with cases like rheumatic heart disease, you can't, to prevent complication from rheumatic heart disease, oral health is critical. I'll end by saying that you in the diaspora knows this too well. There are certain microorganisms in the mouth that have been found in the brain of people with Alzheimer's, people with dementia. Oral health is connected to colon cancer, heart disease, lung disease. Our mouth is part of our body. And this ministry focuses on holistic health. And in this holistic approach, we realize that oral health is a very important player. And we are very happy to have this town hall meeting today, because our diaspora is very important to us. And we partner with the diaspora, and we would like to say, let this partnership be more grounded. Let us look at other ways at partnering in terms of doing more preventative services. Let us partner in terms of infrastructure development, adopter clinics, education, because most of our dentists here don't have the opportunity for postgraduate education. So we can look at upskillings and all these other things. So let us have the conversation. I know you have heard about cases of people doing extraction and doing damages. Yes, we do have those cases. The problem with those cases is that those persons who come to Jamaica, they are not coming through the legal route. They are not coming to the dental council. So in terms of having the hard conversation, it does happen. However, this is not to belittle the work that the diaspora has been doing, because you've been doing a great work, and we want this work to continue. Thank you very much.
Thank you very much. Dr. Mackenzie, who has given, I thought, a good overview as to the extent of the program and how the program is expanding. And I think that's important to all of us, both here, but also to our partners in the diaspora, because it gives an indication of what is possible. And essentially, that's what we're trying to do. We're trying to broaden the scope, create additional opportunities, so that the partnership can be enriched, and ultimately, of course, the Jamaican people can benefit. But we do have a strong team here. I want to commend the team, Dr. Mackenzie and his 80-plus dentists, and the team works hard, and they treat a number of persons each year, but the partnership is also of value. The issues around coming to Jamaica, we felt was important, and the technicalities involved in the visits, the registration process, the bringing in items. While I know that a lot of persons are aware of it, we have tried to make the process easier by establishing our foundation. And I would like now to introduce or to ask Mr. Cephas to, he needs this, Mr. Cephas to just give a very brief overview as to the National Healthcare Enhancement Foundation. He heads it up, what we do, and how it can help you to make your visit as smooth as possible once you decide to come in and to partner with us on any of the work that we're doing. Mr. Cephas.
Thank you, Minister. Good afternoon, all that's present here at the Pegasus, and good night to all the members in the diaspora in virtual world. Thank you for joining us. And let me give my personal public thanks to all the members of the diaspora that have contributed tremendously to the public health sector. Your donations, we cherish them, and they're valuable to us. Thank you. Let me now go through a quick presentation on the National Healthcare Enhancement Foundation. All right. So a little background and information. The Ministry of Health Policy and Procedures calls for the establishment of a foundation to receive gifts and donation intended for the ministry and the public health sector. The National Healthcare Enhancement Foundation Limited, a registered charitable organization, was established February 27, 2022, early last year, and it is an agency of the Ministry of Health and Wellness. Prior to the establishment of the National Healthcare Enhancement Foundation, the entity that we partnered with was the Health for Life and Wellness Foundation. That entity, we have now not in partnership with them, and we have established a new foundation, and that new foundation is established, and it's staffed and resourced to promote and to advance the philanthropic giving in a much better fashion. As a registered charitable organization, the foundation enjoys certain key tax relief and benefit to donors, and it helped to reduce the donation burden of costs coming into the country. Some of those tax relief that the foundation offers, well, for donors that donate cash or in kind, a tax benefit can be, a tax deduction can be taken against their income. That tax deduction primarily applies to local entities. The foreign entities, they're governed by the laws of their country, and 501(c) has to go through that. Custom duties, when your donations are made through the foundation, this is overseas donation, custom duties are waived. There's a relief from the custom duty that is charged, and those duties can be excessive. They can be very high. And also general consumption tax, GCT is also, you get a relief from that, and special consumption tax. So all those charges, duties, and taxes makes the donation much, much palatable in terms of cost. The governance structure of the foundation, we have a board member of 9 individuals and reporting to the minister. And under that, you have an executive director, who is myself, that sits in that role, and a staffing of 6 individuals underneath that. That is very, very important. Prior to this, the foundation was very, very thinly staffed, really only myself and a secretariat assistant from the Ministry of Health. The minister and the permanent secretary of the Ministry of Health has deemed it necessary that the foundation is fully funded, and we are right now and in a much better place to advance philanthropic giving. So, with that said, who we are. The National Healthcare Enhancement Foundation is a registered charitable that manages and administers mobilized philanthropic giving to the public health sector, and it is an agency of the Ministry of Health. What's our vision? The National Healthcare Enhancement vision is to be the preferred philanthropic partner for advancing access to quality health services and to promote healthy lifestyles and environmental practice in Jamaica. You can, as a donor, engage with any philanthropic, any charitable organization in Jamaica, but we want you to engage with us because we believe our partnership, you will get the best results from that. What's the mission? We work collaboratively with philanthropic partners and stakeholders, both domestic and international, to advance the mandate of the Ministry of Health, to ensure the provision of quality health services and to promote healthy lifestyles. Okay. One sec, we're trying to... Stephen, can you assist in getting back to the slide? Thank you. All right. So what do we do? Essentially, our services can be classified in 3 areas. 1, facilitate donor giving. What that does, goods and services that are donated, we facilitate and administer and coordinate the efficient and effective end-to-end process of the donations to the country. That process at times can be tedious, but we are here to make sure that process from an end-to-end state is done effectively and efficiently. Where medical missions are concerned, we also administer and coordinate that process, and we're here to make sure that is efficient and effective. There's a credentialing process that has to go through, that you have to go through for medical missions. And that process, again, we help to facilitate it and make it easy. Many of you know how difficult that can be, but our engagement allows that to be much, much easier. In terms of facilitation, as mentioned earlier, waivers of custom duties and taxes. Given our charitable status, when donations are made, we have the ability to have the duties and the taxes waived. Customs clearance. All goods that are landed in Jamaica from overseas, we handle the customs clearance of those goods and all the costs associated with it. So this eases the burden on the donor. Second, mobilize donor campaigns and programs. Prior to this foundation, the posture of the foundation before was what I would call passive. We were engaged primarily in number one, facilitating the donations. Now we are in a position where we proactively seek to target and mobilize donor support and campaigns that meets the needs of the public health sector. If there's a hospital, if there's a health center that have a particular need, we look to reach out to donors and see how they can support that. Donor programs. We also catalyze donor programs that meet the needs of the public health sector, hospitals, health center, and also the donor. A classic and a good example of that is the Adopter Clinic program, the brainchild, the baby of the minister. That program is a structured program, and we are looking to do far more of that, and it's well received by the donor community. Thirdly, we seek to harmonize donor engagement. Donations that come, what we want to do is to make sure that donors, the needs of the public health sector are met. There's a lot of times when donations are made and the donor wants to donate a particular thing in a particular facility. And what we were saying to them is, let's have a discussion on how to best bring in donations so that it meet the needs of the particular health center or particular facility. Also, we seek to engage with the donor to make sure that the donations is quite equitable. Donors usually, we have experience, they want to donate to Cornwall Regional, to Maypen, or to this particular. But we're here to have a discussion to say that particular facility is not in need of. How about Princess Margaret? How about a KPH? And those discussions is what we facilitate. Very, very important in order for the donations to be very, very effective. Quickly, let me run through the donation process. From beginning, there's an engagement process with the donor, engage with the foundation. There's a preliminary evaluation of the donation. Then there's an offer of the evaluation by the donor. Then we do an evaluation, a more thorough evaluation and an acceptance. And then after that, there's the shipment and delivery, and then the customs clearance and delivery, and then a handover acknowledgement. Let me end now by giving a few do's and don'ts, and very, very important. Things to do. Engage with the foundation as early as possible on for preliminary evaluation of prospective donation. 2, respect and follow the guidelines, the processes, the requirements for donations and medical missions that are provided. These things help. For missions and donations that require donors to be present in Jamaica to fulfill the finalization of the process, plan early. Plan early. Time is your best friend. For medical missions, at least 3 months in advance. Upon preliminary indication of a viable donation, always communicate your donation with a donation offer letter. In the case of mission, a mission intent letter. Donation should be mindful of the support to the need of the public health sector. You might want to donate one thing, but be very mindful of the need of the public health sector. For overseas donations that require shipment, pay great attention to the consignee information that we provide and communicate. Very often, that simple thing causes a problem. If the foundation is the National Healthcare Enhancement Foundation Limited, it must have the limited at the end. It's a different entity to customs if it don't, and that can be a problem in holding the shipment up. Things not to do. Do not assume a donation will be accepted. All donations are subject to an evaluation and a due diligence process to determine acceptance. Donations for which you expect in-country support and facilitation by the foundation, do not ship the donation without being given prior approval by the foundation. All right? And then lastly, my contact information. I ask everyone to take note of it. I make it available to diaspora members. Many of them have it. And I am available all the time once I'm up. It's an easy way to get access to me. So please make a note of that.
Thank you very much, Mr. Cephas, for that overview. I think it's important because we really want to encourage the diaspora to have an efficient entrance into the country, both as a mission or with goods that they support the missions with or just send. It is worth noting that if you have an alternative foundation here, you could always work with them. But this is our foundation in the ministry, and it was established specifically to provide an easier entry into the country through the Ministry of Health for health-related missions. So a lot more can be said there. We're on the website, the ministry's website, but you have Mr. Cephas's contact. Okay, we're going to go right into Mr. Joseph Wright, Executive Director of Great Shape, because we wanted to have a mission who is actually doing some work here now. So it was quite convenient to hear a little bit about what he does, his entity, and any other comments. And then right after that, we go right to you, our audience, for your questions and your comments. Let's hear it now from Mr. Wright. Mr. Wright, go ahead.
Thank you, Minister, and Dr. McKenzie and Mr. Cephas. It's an honor to be included on the panel today and to have an opportunity to speak. I'm not a dentist, but as the executive director of a nonprofit from the U.S., we've been doing dental work in Jamaica in partnership with the Ministry of Health, in partnership with Sandals Foundation for 20 years now. We're celebrating 20 years of dental work, 35 years as a nonprofit dedicating to providing access to healthcare and education to the people of, first the people of Jamaica, and then now more broadly to the people of the Caribbean. So we are very, honored and happy to be able to come each and every year as an ongoing, sustainable program for delivering services. Great Shape is a nonprofit founded in the state of Oregon, 1988. We're 35 years old, and we have three major programs that we run. Literacy programs, working with the Ministry of Education, of course, providing teacher training and trying to uplift students in primary schools who have fallen behind. On the healthcare side, we run an eye care project that delivers glasses to several thousand people every year, including prescription glasses. We take prescriptions here in the field. We send them home to the U.S. The glasses are made there. The frames are fitted here. We send the frames home. The glasses are inserted, then we bring them back and distribute them. We do glaucoma treatment, laser treatment, and we do cataract surgery, again, in close partnership with the ministry, I think at Cornwall Regional and previously in Falmouth. So these are all things we do on the eye care program, and it's an incredibly well-received services by the people who come out to our clinics. And then our biggest program, and the one that we started with in 2003, is our 1,000 Smiles Dental Project. And I recognize a lot of faces here tonight in the audience, people that we've worked with. some of the dentists here actually volunteered with Great Shape through the program through the years as students here in Jamaica. And so it's nice to see friends and family here as well. But the Thousand Smiles Dental Project, each year, I think this year we'll have roughly 700 volunteers from all over the U.S., Canada, as far as Europe, of course, here in Jamaica. We work in 4 different countries now, in Turks and Caicos, Grenada, St. Lucia, and our largest country, biggest program is here in Jamaica. This year we had 9 clinical weeks of services on the dental program, and we focus on comprehensive services. I know that's a really important aspect for Minister Tufton and Dr. McKenzie, that we're not just doing extractions or extractions only or extractions first, that we're really focusing on prevention, cleanings. We have a sealant program that we've launched here. We go into schools, we partner with schools, we make sure kids are getting sealants on their newly erupted molars. Oral health education program, we probably see around 10,000 children a year in the schools doing oral health education, reinforcing actually what they've already learned and how smart these kids are with their teeth and their, their oral health already. But we come in and we try to reinforce those messages, eating well. And then, of course, fillings, restorations, root canals, saving every tooth we can. Because somebody said it earlier, but, a smile, and especially in a tourism-driven economy, a good smile is critical to the, to the life journey of an average Jamaican, especially a young adult coming up, being able to have a nice, beautiful smile working in a hotel means a lot. So we really do focus on trying to save every smile we can. And of course, when it's absolutely necessary, and only when it's necessary, extractions. And of course, a few years ago, we launched a denture program on our project. We do a couple different kinds of dentures, and we have a vision for the future, for the near future, hopefully, of building a denture printing lab where we can do digital scanning of impressions, send them to a 3D printer here in Jamaica, and have them produced and sent out to people. So that's one of our future goals. So we're just really honored to be, partnering so closely with the ministry over all the years, and of course with Sandals Foundation, who provides an incredible amount of support for our program. Deserve a lot of credit. I just want to say we just finished our last week on Friday in Ocho Rios area. The patients are incredibly grateful, but also just the need is seems like it's endless. We could have gone another 5 weeks and we still would have had patients waiting to get into our clinic. So there's a lot of need out there, and we're just happy to be able to fill some of the gap, in terms of services. So I think.
Thank you very much. All right, so there you have it, folks, particularly our guests in the diaspora, or family in the diaspora who are listening in. Just gonna take 2 minutes. It's now 7:15 Jamaica time. So by another minute or two, we'll open the floor, and we'll try to go up to 8 or maybe a little after. We started a little late, and really want to listen to you and to respond appropriately, because at the end of it, we're hoping that we will have a common understanding, to the extent that there may not be clarification, to the extent that there's a requirement for that, but perhaps most importantly, a renewal of the partnership and a strengthening and expansion of the partnership. My observation would be, and this is now from the policy perspective, that there is a need, and that has been said by all here. That need is a need for good oral health, which is a critical part of overall health. And, I know that I made some comments recently which sparked some questions and concerns, and maybe even some upset. And that's certainly not my intention. But my role as minister is to advance a position from a policy perspective as to what direction we need to go into to improve and enhance the healthcare provision in the country. I don't think anybody can challenge me on the positions I've taken around partnerships, because I've championed partnerships in so many different ways because I believe in it and I think it's necessary for good health, whether it's private, public, NGO, or otherwise. And we have several examples of that. But October, as a special focus on Oral Health Month, brought my own attention to the need, I think, for us to enhance our oral health service provision, both internally in terms of our local teams, the partnerships that we formulate locally, and those that we formulate with our diaspora. And that is to look at those areas that Dr. McKenzie mentioned. The education, the public education around good oral health hygiene, the connection between good oral health and overall health, and of course, preservation as a first service. And you saw the areas, you saw the categories of people that we're targeting, whether it's in the schools or otherwise. Now, when I spoke in the sectorial in May, I believe, this year, we announced a program called Second Chance Smiles. And the reason why we announced that program was because of a recognition of the need to correct for those persons who had lost their teeth because of the connection between overall health and bad oral health, which includes not having your teeth. And I made a point, which some may have misinterpreted, but I'm okay to clarify, that when a Jamaican man or woman has lost their permanent teeth, particularly, well, anywhere, wherever they are located in the mouth, but certainly the front top or front bottom, it does a couple of things. From a clinical standpoint, it impacts their overall health. I mean, the most basic being the process of consumption and digestion. Because if you can't chew, then you have a problem. And it does impact. And that's clinically proven. But secondly, there is a disadvantage from a socio-economic perspective. You don't hire people very often when they have no front teeth. It places them at a disadvantage, even if they're qualified. It's unfortunately discriminatory, and it happens. Secondly, even from a social perspective, I made a point, some people may find it funny, but I'm being serious. I talk frankly. You know, even in terms of your social interaction, your relationships, whether it is an intimate one or a social one, it places you at a disadvantage. That's a reality. And if people don't want to recognize it, then I think it is. I have a rural constituency, I see it, and I won't move around Jamaica a lot. So my intention for Oral Health Month was to say, let us find ways to preserve, through public education and through procedures, and strengthen the relationship with the diaspora to ensure that it happens. And yes, I did say that the idea of bringing students into the mix, whether they are students here in Jamaica or from overseas, and where the focus is more on extraction as opposed to saving and preserving, then it's something that we need to review, rethink, and try to shift with a greater focus on preservation. And I think that was the position I've taken. So I'll give that as a kind of my take on where we are. And I'd like to now open the floor. I suspect the technical people are going to manage that. Stephen, is that you? All right, so we have Stephen Davidson, who's head of our communications unit at the Ministry of Health and Wellness. He's at the computer, and he will direct the traffic as it relates to the questions and comments, and we'll do our best to respond. Stephen, over to you.
Yes. Thank you very much, Minister. So we're inviting the persons on the Zoom. You can raise your hand to be acknowledged. And Minister, we have about 66 persons who are logged on. Just from the chat here, Dr. Sandra Coley Duran, she's asking, outside of donations, how can diaspora members assist tangibly?
Well, that's a great question, and you be careful what you ask for because you may get a long list. But, you know, the Second Chance Smiles, as Dr. McKenzie said, is kind of a signature program trying to correct a legacy of extraction. And we set ourselves a target of 10,000 dentures because that's what the budget could handle at this point in time. There are other things we're doing. We're trying to enhance some of our local oral health clinics with more equipment, machinery, and so on, materials. So there are other things that are being done. But, you know, it would be nice to say, let's do 20,000 replacements. Now, what that may mean is a partnership that says we measure, we submit, and you make. Because we don't have to make the dentures in Jamaica. Just as you have just said with the glasses. You do the measurement here, you send the prescriptions abroad, they're made, they're shipped out. We could find a partnership like that, and I suspect it wouldn't be that difficult because it's really information flow one way, material or the dentures the other way through the foundation, which would make it very easy to do. The other option is to look at how we equip our facilities to support some more advanced services, as has been mentioned earlier. So there are ways to do it. I suspect if you were to get in touch with Dr. McKenzie and his team through the Wellness Foundation or directly, you'll get a real menu. But the Second Chance Smiles is the one I'm pushing because I really think it makes a difference. I tell you, the first person who received dentures, someone from Westmoreland, he has even done a song on his newfound self-confidence. And, you know, he volunteered to go public because you don't have to. You know, some persons don't want to. And he's giving testimonies all over the place and making some claims about his self-confidence that I probably would mention here. But it does impact one's health and self-confidence, and I think that's something we all want to do. Thank you very much for that.
Thanks, Minister. We're going to go to Olive.
Hi, everyone. I just wanted to ask the charitable person who spoke, how does one get into that program? Because many times it's, how do you get in? What's the process?
Sure. Thank you for the question. Well, I know there are a number of missions that come to Jamaica, but I can speak for ours. The name of our nonprofit is called Great Shape Incorporated. If you Google Great Shape, we come up number one, I think, normally. And every February, we populate our website with the different dates and locations for, it's a 10-day program for volunteers. And so you choose which dates and locations that work for you. And then there's an application process online. So that's how you can get involved. Everybody's welcome, by the way. Roughly a quarter of our volunteers have never worked a day in their life in the eye care field, in the dental field, or they become helper folks, and they do registration, and they do all the kind of support jobs that we need help with. And so everyone is welcome, friends and family, and of course, dentists and hygienists and other healthcare professionals. But that's how you would join with Great Shape.
All right, thank you very much. We're going to go to Dr. Rule, Dr. Gary Rule.
Hi, thank you. So Dr. Rule, I'm the health sector representative for the Global Jamaica Diaspora Council. And I think Minister probably partially answered my question. The first question really was, you already have the Adopt a Clinic program, which I think is excellent branding to help the diaspora be engaged. So I'm kind of wondering, will we have an Adopt a Dental Clinic initiative in addition to, you mentioned Second Chance, et cetera, because there are other sectors of the oral health delivery system that Dr. McKenzie mentioned, the school-based, special needs, maternity health. So are you thinking about branding something like that, Adopt a Dental Clinic, separate from the medical clinic, where the diasporans can actually be engaged and be involved in that way? That's the first question I have. And then the other question I have is, I'm assuming there is already a framework for dealing with potential quality of care concerns. right? So I'm curious about, and you're looking around. So for example, if someone complains about a service they've had and they're concerned about they've had some harm to them, what is the process in terms of the review, the investigation, a citation, a suspension of their license, a revocation, and barring them from actually doing anything in Jamaica? I think Dr. McKenzie mentioned you have some dental providers who present themselves in Jamaica, not registered, not licensed. What has been the enforcement action against those persons? Are they cited, suspended with their license, and they can't come back and do anything in Jamaica?
Okay, so may I comment on the first? First of all, you have just won a whole room full of fans by making the suggestion about a dental surgeon. They're all dentists here, and so they like the idea. Normally, a oral health clinic is aligned to a primary healthcare facility. So when you do an adoption, it's both. But the dentist in the room will say, no, they don't get the special attention that they would like to get. And therefore, I would support the idea. Maybe we should throw it out right here and say to Mr. Cephas here, maybe you need to craft a protocol around the possibility of just zeroing on the oral health facility, even if it's in a facility, a larger facility, and see how that works. Because yes, you're right. I'm sure you'll find some people who may want to do that. So great idea, and we're not going to refuse any good idea that will enhance the quality of the service. So maybe we could look at that.
Yeah, but let me say this. It is available through the Adopter Clinic program. The donor, you can designate a particular area of interest that you want to support. That's perfectly fine. So within that framework, it exists. We have an adoption, the Glen Vincent Health Center, for example, where the donor input wanted to look at the pediatric area and have that improved. And that was the understanding and the agreement with there, and we do that. So the framework is available there.
Yeah, so I guess maybe a little more emphasis and to say it can be done would help. So, but that's a good suggestion. The other around the persons who are engaged in malpractice, which is a problem. Let's accept it. It is a problem. Up to this week, I believe I sent you, Dr. McKenzie, something on a particular service that was being advertised. Maybe you can outline what the process is to dealing with that.
Well, thank you very much, Minister, and member of the diaspora that actually brought that question. Because yes, there are occasions when members of my dental team will hear that there's a mission in their local that they were not informed by the Ministry of Health about. Because the way we do mission is that the intended service provider or mission will write to the local authority, which is usually the health department of the particular parish. And they will get on board the medical officer of health and the dentist in that parish. So once the document is signed at that level, our team is involved. The document then leaves there and comes to Mr. Cephas' section that will route it to me and also to the Dental Council. We carry out, and we're advocating for this policy, we carry out our surveillance to ensure that where the mission is going to be, that the place is appropriate, you have running water, you have proper waste disposal, and that there's an establishment about continuity of care. So if there's an emergency, how that case will be managed, and if the doctor leaves, etc., and there are persons having any kind of adverse effect later on, then they will come through our system and we'll deal with them. Now, once we find a mission that is not approved, we shut them down. And I have many dentists that are here who have done so. I know Dr. Wendy Chuck Francis, Dr. Sandra L. Cameron. We go literally, we tell them to stop. And we inform the council, and what the dental council have been doing. Once we hear of the team, those persons will never get any permission to come to Jamaica again. We are that serious because we want people to use the right channel and to do the right thing. So we like the help, but we also want it to be done properly because the partnership work hand in gloves because the continuity of care is very, very important. The partnership also help us to bring that patient into a system where, let's say, that patient needed a filling, but the patient had other issues like periodontal disease, and they need a kind of follow-up care. And this is where the public services will enable that kind of continuum of care that will help that patient, as one of my colleagues earlier said today, the health promotional aspect of things. Not just telling you come and get a cleaning, but letting you understand how you can maintain your own oral health. Because after all, your health is your most important resource. And this is what we want people to understand. And that oral health is a critical ingredient to that. So that's what we do.
Okay. Thank you very much, Dr. Mackenzie. So essentially then, if you're involved in unregistered practice, you could be prosecuted. It's illegal, and the enforcement does take place. Maybe we need to do more. It's really about monitoring the environment, but we have done that in the past, so it's illegal. That's the straight sorry? And the penalty is $1 million, $1 million by law.
Or
by
1
law.
month imprisonment.
Or a month in prison, I'm told. Maybe we need to increase that. Next question.
Yes, thank you, Minister. So Roger Mackenzie is asking, what strategies are in place to work with vendors outside of all schools selling sweeties? He also said, I volunteered with Great Shape several years ago and did oral health education.
Okay. So quickly to that one, sweets are sold everywhere. So whether you get it outside the school or in the pharmacy or supermarket, it's all around you. So there's a public education program around sweets, and the oral health team, when people visit to do their regular checkup or cleaning, which I think we need to encourage more of, to screen as opposed to just cure. And that's, Dr. Mackenzie spoke about know your numbers. I don't assume that everybody in the diaspora knows about that. It's a screening initiative that we launched recently where we go into communities, parish centers, town centers, and we encourage people to do their BMI, blood sugar, blood cholesterol, and so on. Because we've found that a lot of people don't know they're sick or their numbers are out of whack until they end up in the accident and emergency. So the program so far has been very successful, so we're going to continue to push that. But that also includes the oral health component. So the education is a key part of trying to discourage. The management of the school environment, specific to your question, is contained in a nutrition policy that we have gone through as a green paper and is now being written up by the consultants to form a white paper, then policy, which will see stronger regulation around what is served in the schools and also what is sold on the school compound, which also includes the immediate vicinity outside of the perimeter fence or gate. And we have a lot of that. So part of the consultation process also involved the vendors on the outside. I was involved in a number of the discussions where they will have to comply or we will use enforcement to remove them. Many of them have been there for many, many years, and they serve an important purpose. It's really trying to get them to comply. And so the school nutrition policy for the future, hopefully, is likely to be what we will use to push that response. Next question.
Dr. Sylvanus Thompson is asking for a question to Dr. Mackenzie. Is there a mobile unit in the Ministry of Health and Wellness? If yes, how can members of the diaspora access it to support community health and wellness fairs?
I was looking for that question because I was actually looking for the diaspora to tell me when they'll be bringing in a mobile, right, Mr. Cephas? Currently, we don't have a mobile, but we are looking into the process of getting a suitable mobile in which we plan to have one per region. We currently partner with Great Shape, and we get Big Red to use when Great Shape is not using it. and I'm sure you can get directly in touch with Mr. Joseph Wright, because he will tell you could get in touch with him. And also, we can also put you on to Colgate Palmolive, because Colgate is big on humanitarian and volunteer mission, and you too can get that mobile. I know in Manchester there's a Tree Angel Pharmacy that does a lot of dental work, and a lot of diaspora group have also been able to avail themselves of that mobile. So where we may not have one for ourselves, we can tend to point you in the direction where you can get a mobile actually to use.
All right, thank you very much, Doc. We're going to go to Jackie Knight.
Hello, can
Hi,
you
Jackie.
hear?
Yes, we can hear you.
Yes, good evening, Dr. Mackenzie, Dr. Tufton. Happy to join you and the rest of the team from Jamaica. I've had the privilege of working closely with Dr. Mackenzie for the official opening of the dental school at UTEC. I'm currently in touch with the school, and I know several students are in need of partnership, internship with certain institutions abroad. Are there any MOU agreements available with universities? Can members of the diaspora, some of these foundations, identify strategic alliances for the students to get internships and exposure opportunities? Or scholarships as well, scholarship available for collaboration?
I'm no longer at UTEC, but what I can say is that I have known of members of the diaspora that have made this possible. We have a Jamaican, a Professor Swan from Harvard University, that has actually provided a sort of a relationship with Harvard University and the UWI Mona Dental School. I know also of a Jamaican, Maurice Miles, and other Jamaicans that have made it possible for Jamaican students and graduates who after dental school have been able to matriculate into what is called the international program in the United States. However, through the Ministry of Health, we have a partnership with the University of Penn. So if there's somebody who's interested in special needs, Penn has enabled our students here and dentists to go on their website free of cost and do all the training in managing special needs patients. And if they finish those courses, then they're able to get what is called a online, not online, but a real immersion program at the University of Penn, free of cost. However, through Great Shape, we have been able to articulate many partnerships for our students, but I do believe that there are persons within our diaspora. I know one person right now who is the dean of a dental school in Missouri, and many other Jamaicans that hold significant positions in academia overseas, that probably in this conversation, this dialogue, we could probably look at how we, as I said before, we don't have much capability of doing upskilling process in dentistry or even postgraduate training. And I do believe the diaspora does serve can serve a vital role in articulating those processes. And I think we welcome this discussion. And I know, Jackie, you're good at bringing those moving parts together. So I'm sure the minister will welcome that, and we truly would appreciate that kind of collaborative effort with the diaspora group.
Thank you very much, Jackie. Okay, Stephen, and another?
Yes, we have another one from Dr. Michelle Malcolm James. She's saying, in an effort to enhance oral health, has there been any consideration to add dental hygienists to school health-based programs in addition to the nutrition program in schools?
Okay.
Well, Minister, I think she's probably being very prophetic, because we have met, the group have met with the minister, and we have been doing our due diligence, and I've just basically 2 weeks ago finished the policy thing and we have sent it through to through the PS and through HR for the engagement of the dental hygienists that are critically important. So the ministry has given, a positive feedback to that. And I'm sure in the future they're going to see that dental hygienists will be playing a significant role in dentistry.
Okay.
Thanks very much. We acknowledge now Dr. Claudia Brown from the UK.
Good evening. Hello. It was actually more of a comment. I just want to say thank you to the panel, to Minister Chris Tufton and Dr. Mackenzie, Mr. Cephas and Mr. Wright. Thank you for your very informative talk and information. And I was just putting my hat in the ring. I will be coming to Jamaica myself, as you can hear, I'm British, but I'm second generation Jamaican. My parents were born in Jamaica and they emigrated to the UK. And I just wanted to say that it's wonderful that you have a plan for the hygienist to also come on board as well. So I'm actually a specialist periodontist, and I'm more than happy to provide some CPD when we're over there in December, but also we're coming with a team of orthodontists or surgeons. So we're more than happy to help from London. And that's what I wanted to say. Thank you.
Mike, check. Okay. Firstly, let me thank you very, very much. I mean, I feel value in this communication based on your offer, and obviously you are very interested to participate, and we appreciate that. And it's something we welcome every single day because we understand that the partnership is what will strengthen the response. So Mr. Cephas's contacts are all there. It's on the Ministry of Health and Wellness website. So the follow-up on the details are possible. So thanks again.
I think I have about 2 more questions, Minister. This person is asking what programs are in place to increase the number of dentists on the island, in particular the rural areas.
Okay, to increase the number of dentists. So there's clearly a training. Dr. Mackenzie can comment more on where that training is, how many dentists are being trained. This is in Jamaica now. And of course, we have persons who are trained overseas. So I think that we see numbers going up. Now, if you're talking about the public health system, then I know that that is under review now. And Dr. Mackenzie can give some better particulars on what the planning is involved. And maybe you can give a kind of stats on the number of oral health centers, number of dentists, number of support staff. You want to just comment quickly on that and what the future looks like?
Okay, thank you very, very much. Just to state up front, we need all categories of oral health professionals in the public sector. And the Ministry of Health has embarked on a program under the primary health care renewal because we believe that primary health care is indeed a fundamental vehicle for reaching many individuals because primary care is geared towards meeting you where you're at in your respective communities. We have just finished a microplan, and basically what the microplan is geared at looking at our healthcare needs, not from just the service perspective, but also the workforce perspective. As I said before, we have 86 dental surgeons in the public sector. We have just a few dental hygienists that are primarily employed, not as hygienists so much, but in the southern region. We have a remarkably reduced numbers of dental assistants, and we need significant amount of dental assistants. And we also have a reduced numbers of dental nurses. So what we are looking at now under the primary care renewal and the microplan is a comprehensive and holistic approach to looking at our workforce approach. And so we have what the WHO has as the workforce indicator for staffing needs. We have 83 dental facilities island-wide in the primary care setting. And what we have done is to just look at, say, what we call a dental professional shortage area. one dental professional to a population, say 1 to 5,000. If you have it more than that, you're considered to be a dental professional shortage area, which basically means most areas out of Sarah, including St. Thomas, is a dental professional shortage area. So under the microplan, there is a move afoot to first address those facilities. So we are looking at 3 main type of facilities: the community dental facility, the district dental facility, and the comprehensive. The comprehensive facility is going to have like 5 dental units with a dental consultant, specialist dentists, with hygienists and dental nurses. The district facility will end up with having like 3-chair facility with a specialist dentist and dental auxiliary hygienists and dental nurses. We're also looking at engaging, because of Second Child Smile, having dental technicians for the first time in the picture. We're going to be employing and looking for dental technicians for every parish. So we're looking at a maximum of 20 dental technicians, and also for dental nurses, because the new way of training the new dental nurses is that we're no longer training direct entry dental nurses. They're going through the pathway first of becoming dental hygienists and then specialize in dental therapy. That way, what you have is a more sustainable approach, and this is the approach that is used all over the world. It is a sustainable model, because if the government after a while cannot employ too many therapists, such therapists can work within the private sector as hygienists, and their models that show that it works all over. So where we are right now is that the microplan is completed. I can share the microplan with you. It is based on a demand-driven system, or where we're looking at how we train and what the needs, looking at what the needs for dental services are. We have 2 dental schools that are putting out roughly 25 students a year. And basically looking at the Jamaica need right now, Dr. Prince was here, we have about close to 400 registered dentists in Jamaica. And we are moving from 162 dentists 10 years ago to 400 dentists currently. And we're looking at all the out-migration and all the various other things. So where we're going really with dentistry in Jamaica is really in a positive direction. But we're not talking about just dentists alone. We're talking about the entire team, because dentistry function within the context of a team. And we're not just talking about general dentists. And I see my very good friend Susan Gray, orthodontist. We're also thinking of bringing on board the specialties that are needed to provide the services. So Minister asked me early on, yes, we do have a problem with fake braces. It is a major problem. Nature abhors a vacuum. And where people can't get care, they try to seek to get it in so many ways. And we are working at fixing those, first from the supply end, and secondly from the legislative end, where we are working with the police, and Dr. Prince here from the Dental Council is here. We have engaged the Office of the Company Registry, because many people have registered dental companies and they're not dentists. And we'll be shutting down those companies. The next thing we will be doing is actually using the Public Health Inspectorate, because people's life are at risk. Because when you go and they have all kind of things in your mouth that are not sterilized, you don't know where these people come from, they're unregulated, and therefore they're providing all, and we have seen firsthand the kind of damage that have been caused. So what we're doing, going with the public health inspector team, etc., and we will be prosecuting those. So if those persons are interested in a profession such as dentistry, we have 2 good schools, and we can guide them how they can probably start even from the level of an assistant, work straight up, because there is a way to do things right. And we intend to, first and foremost, offer the best quality oral health services that we can provide. And of course, we look forward to the diaspora group in helping us in terms of what it is we are promoting.
Thank you, Dr. Mackenzie. Go ahead, Stephen.
So final comment from Beverly Frey. She said, I just joined the discussion and I caught the tail end of the information about dental hygiene. There's a dentist in Miami who may be willing to help. What type of help are we talking about?
Okay, so before we answer that specific question, I think it's a good question. I wanted to use the next 9 minutes or so to just move through the panelists and then I'll do some closing remarks, and included in that will be that response. If you have no other question online, no?
Those are they.
That's it for now, okay. Because I think I'd like to see us kind of refocus or focus some attention around how the partnership can be strengthened. Because I'm hoping that coming out of this, there will be a better understanding, firstly, of what you guys do on the oral health program, and how we can facilitate a stronger relationship. What are the specific areas of need where that relationship could be enhanced? And it could be anything from training to public education to anything else. And hopefully out of that, any sort of follow-up that may be necessary. So maybe I could start with our only NGO on the platform, Great Shape, and ask what, in your estimation, based on your experience, where do you see gaps that could be filled relatively easy based on your role that you play and the willingness of the government to collaborate, or areas you want to suggest that you currently are not involved in?
Well, thank you. I love the fact that we partner so closely with the Ministry of Health. There was a question was brought up to me earlier about, before this panel, about follow-up care and continuation of care. And I think there's a great opportunity for us to collaborate on follow-up care as it relates to patients who come in. And of course, there's a number of patients after any dental mission who need to see a dentist after the mission may have gone. And so collaborating on that. And I also would like to see some more collaboration on advanced services, whether it's making crowns, lab work, of course, dentures we've talked about, but crowns, root canals, periodontal treatment, stuff that is treatment that's maybe a little bit difficult and outside of the normal scope of a traditional mission group, but yet to find creative opportunities where we can work together to provide resources and maybe staffing, maybe even within the existing ministry infrastructure, to be able to provide more of these advanced services. So those are a couple of things that come to mind.
Okay. Courtney, is there anything from the questions that you would like to add or reemphasize?
Well, let me say that a lot of I hear a lot of questions about what can we do, what are the needs. Dr. Rule mentioned it. How about adopt a dental clinic, that sort of stuff. So one of the things I think very important, I tried to mention this earlier, is that the posture of the foundation has now moved to one where we are proactive and we are looking to partner and develop programs. So discussions, outreach to me, to the foundation, in talking about these things is where we can make it happen. And what I do is I will bring in the relevant clinical folks that can shape and determine which you want to do and the kind of donation you want to make. So the foundation is a good opportunity to have that dialogue. Sometimes you know that you're going to donate a piece of equipment, but there are times when you're thinking about other things and it can be more bespoke. So having a dialogue with the foundation, we can facilitate, we can enhance that, and we can make it happen. And it's the sort of thing that we're looking to do.
Thank you very much, Courtney. Dr. McKenzie, your take on what you think the opportunities are for collaboration. You may want to emphasize a few of the ones that you think are immediate and see how that can work.
Well, definitely. Thank you very much, Minister. My take on collaboration is first and foremost, as what Joseph and I had worked on earlier. If we could work on first a preventative program, because prevention, oral health and oral health conditions are largely preventable. We know there are needs for end-stage disease management, but these are usually very, very expensive. It involves a lot of equipment and expensive material. And hence some groups may be dissuaded about doing some of these things and want to go the low road, which may be just cleaning and extractions. So prevention, there's a wonderful opportunity for prevention, sealant programs, teaching and educating our people in some communities where we have no dental staff. Also, to come on board and utilize our dental facilities. I've heard a question asked about a mobile. We may have a dental facility close to where you want to go. And the best place for you to go is to actually use that facility that we are at already. So you can get the support and the sort of a cross-cultural fertilization can occur where you can where we can learn new things and you can learn better things in terms of how you deal with Jamaicans and so on, and the new changes that are occurring. What I like to say in closing, Minister, is that many times, and Mr. Cephas touched a nail on the head, many times the problems with mission is that the documents reach Jamaica very, very late. And the mission only have 1 week or 2 weeks to turn around. And therefore, I like to emphasize in closing that if you think of anything you like to do, you can get in touch with me very, very early. But remember that 5 to 6 week window is very, very important because you're not just dealing with the Ministry of Health. And customs can be quite brutal.
Can I just not make you have the last word as yet and ask you to comment on what has been part of the narrative around dental students who come to Jamaica, or indeed who come from UTEC or wherever, and are involved in missions? What is the process? Who qualifies for this as a student in training? Because we know they come, they get the sessional hours, it helps in terms of their qualifications and so on. How is this possible to ensure that it's not at the expense of the patient or worse, it doesn't have implications, negative implications for the patient, and at the same time, can it be facilitated and what is the process?
Okay, we're moving in terms of a policy space. We're looking for a one-size-fits-all. So not just a foreign mission, but local mission, there's one standard. For students, we're looking for students particularly who are participating in volunteer mission must first and foremost have the approval of their faculty. Apart from the approval of their faculty, they must be within the clinical year and have passed certain critical competencies before they can even be involved in any clinical thing on patient. Then there's a ratio of supervisors. We strongly maintain that you must have one faculty member present on site to supervise, to see what the student is doing, review the case before the student proceed and is there. So we're talking about direct supervision of what is taking place. So it's not a case where they're going to go and leave the student and the student going to work. We are strongly desisting from that and to say you must have that kind of relationship. The student must also possess certain competency in terms of ethics and professionalism and to realize how important it is to treat the patient with respect. So we're talking about the student must model a standard of care and the dental provider must be licensed. So when you talk about duty of care, we're emphasizing this strongly, that the dental provider, who's the dentist with the license, has an obligation to ensure the safety and well-being, the interest of the patient must be utmost and be paramount. So we're saying no students just come in just to get an experience. It must be in the best interest of the patient, and this is why we're now putting the emphasis, the focus on the practitioner. And therefore, anybody now coming from UTEC, UWR, anywhere want to go on any mission, we'll be processing those like any foreign mission, going through the council and to ensure that we police it. We're going to assign a public dentist from the respective area for audit and quality control to make sure that people abide by what they say they will do. So our aim is to ensure what? That the quality of care that our citizens get is the best quality care, is the care that is needed, and is the care that is appropriate and not what the people want to do. I think this is a good discourse. Thank you
So
very much.
essentially then, just to be clear, there is a policy that is going to emanate in not too long a distance from now
No, not too long.
around how the composition of missions, whether it's a local mission or overseas mission, which will standardize who can practice their trade,
Yes.
dentistry, on a student, on a citizen, what qualification they need to have if they are in fact a student. In other words, it can't be a first year or second year, it has to be in residency. Very important. So I'm learning as I go along, which I suspected it would be the case.
That's the clinical year.
A student in residency, the clinical year, which means they would have passed through all the critical components.
Yes.
And even then, they would need to be registered with the team.
Yes.
That's a new policy.
Yes.
And secondly, they would need to be supervised directly by a certified licensed registered dentist in Jamaica. That's important because I don't think that that has been the case in the past. And I'm not here talking just about the diaspora. I'm talking generally speaking. And I think it's important that we establish those standards very clearly. And we're doing it, and I think it's important for all listening to recognize why, including those in this audience right here at the Pegasus, who are clearly our local people. It's important for the patient. We can't go out there enforcing those who are breaching the rules, and if we are breaching them ourselves, it just don't make sense. And we want to elevate the quality of oral health around full service, and full service is best achieved by this kind of standard that we want to establish. I'm assuming now as a policymaker that I'm saying it the right way. That's
Yes.
my interpretation and understanding of it.
Yes.
And my support for that is non-negotiable because I do believe that is best for the people. Yes. The ratio of dentists per student, 1 to 1.25. Okay, which means that manageable. Don't mean that you're going to just take a quarter of a dental student in residency, but we know what you mean. We know what you mean, right? So it means it's a very close supervision. I'm just speaking simply. Very close supervision. And it serves the interests of the clinical student, if you will, for want of a better term, as well as for the best interest of the patient. And it's something that, stay tuned. How long you think we'll have that draft policy? I will have to sign off on it, but I'm signaling.
We have it already,
my
Minister. So by
intention to
tomorrow,
move.
it's on your desk.
So okay, well, you had a whole day today, so I suspect all of that would have been part of your conversation. So we look forward to that. And I think it's important that you get that out in the diaspora so that persons are aware, so they can plan, and get that out into the local institutions where training takes place, UTech, or the other places, so that they can also plan. Because we don't want to compromise the service or reduce the quality or the quantity of the services and the outreach that we're supporting. I want to close. We're now 5 minutes after 8. We did start a little late, so we're allowed a few extra minutes to go over. By just summarizing what I think are some important points. First of all, I want to thank you. Thank those online for coming on. Really appreciate it. Sorry for the delay. But it seems to me that there's a lot of interest, and we want to capitalize on that interest. And we here in Jamaica we approach it with open arms. We want you to be a part of the build out in all the critical forms that is possible. And Great Shape is a real example of that partnership. And you're all potentially or otherwise can be a part of that partnership. So I want to say thanks. To the first point is that there is a foundation now that will make it easy for you to come in. And easy meaning much easier. I remember when I became minister some 7 plus almost 8 years ago, it was very difficult. I used to get complaints upon complaints, and we had to do something about it. And we have, and I think that's a positive development, where we now have a staff complement, an entity, budgeted, and of course led by Mr. Cephas here, who just outlined those terms and conditions. What is important is for you to follow those. Because if you don't, we're going to meet the hurdles. Some people call me as minister and say they're at the airport and they're trying to clear 2 boxes of something that they just brought in on the plane, and they really are upset that I can't do that. But I can't because it's in their name. The customs will start saying, oh, how do I know you're not carrying it to trade it, to sell it to somebody? There are all sorts of permutations that would just does not make it possible. But if you do the 5 or 6 week lead time, as Dr. Mackenzie said, through Mr. Cephas, and you get the details, which he's more than happy to provide, it will be so much easier. And we don't want you to have the hassle. And, you know, if you can collaborate with a local player, that's even better. But ultimately, the Wellness Foundation, if you ship things in their name, it makes it easier to clear without the hassle or the cost. So I think that has to be established as very important. But then the other issue, of course, is what Dr. Mackenzie has said. He identified, my takeaway, those 7 areas of focus. Is it 7? Yeah. 7 areas of focus. And I'd like you to put that on the website of the ministry so people can revisit. So, and then under each, you put ways to collaborate. So each area, 1, 2, 3. Next one, 1, 2, 3. Because I think we have to give our friends in the diaspora who are willing the easiest path to volunteer and to participate. And that's really what it is. We should make it difficult for people to want to give, not to give, or to participate. And there's a lot of joy in giving. Take it from me. I believe it should be a part of our life, throughout life. They have a role for giving back. So we must make it easy for them. And I think you have listed that what represents the overarching holistic approach to health. So that's very positive. But specifically, I see needs be represented by a mobile dental clinic. I think we really should have a few. And Dr. Mackenzie, I hope on your shopping list you put one from the ministry so that we can purchase one in the next budget cycle, because I'd like to see that. I know we're working with, Colgate and those guys, and we use their, you want one for each region, right? Yes. Well, let's see. Maybe so my audience here at the Pegasus are engaging with those in virtual land. I'm trapped. I need your help. But they're saying one for each region. You have 4 regional health authorities, and I think deservedly so, because it's an important thing, and the outreach is very, very critical. So if we get the specs and the cost, who knows? Maybe we can buy 2 and the diaspora donate too.
True.
Because I know there are people in the diaspora who could easily do that. Before you do it, though, get the specs from the team here. Get the age of the vehicle that is allowed. People shipping 20-year-old stuff and there's a problem. Get the details from Mr. Cephas. But I want to pitch that out there. And the gods will look down kindly on us, right? As he did today with our earthquakes. Yes. Lives still preserved. Yes. But I want to pitch that out there as an ask. Is that okay?
Yes.
That's a specific ask. And to the extent that that is possible, I think it is. And I want to also commit that we'll work together, Dr. Mackenzie, to ensure that we include something in the next budget cycle, because we need to help ourselves also while others try to help us. The second thing that I think is important is the second chance smiles. I really want to make an ask of an additional 10,000 dentures. We're going to do 10,000. We're committed to that. How many have you done so far? Any numbers on off the cuff?
Dr. Hines, we are now up to about what? We did 1,000 for this last quarter.
1,041.
Yes.
Boy, that's lovely. That's lovely since the program has started. We need those testimonials, by the way. You need to put me on to the doc there so that she can give me, because Dr. Mackenzie, you're not giving me, you're too busy. But we need some volunteers to explain how positive this program is, but they have to volunteer, of course. But that's good. So we're going for 10,000, but it would be nice to do 20,000, because there are so many Jamaicans who do not have, who have missing teeth, put it that way. And I believe there's a very easy way. If you have as you say, a 3D
The
printer.
3D printer, yes.
We could easily do with one. That's a good ask too, because I know we need one in our system. And I am committed to looking at that. You and I spoke about that already, Dr.
Yes, and
McKenzie.
NHS said it by one.
But two would be good if we buy one and the diaspora decides to provide one. But also, the measurements can easily be sent in a market in the US where they are currently being done, and we bring the products in and fit them. So we do the impressions here, which we do, and so that relationship, and we can sign an MOU around that. That's easy. That's not difficult to do. So I want to pitch that out as a direct ask. An additional 10,000 and maybe a 3D printer. I know that Great Shape said they're going to do one, which is good, and we welcome that. Look forward to it. And then the third ask, specific ask, is around what someone mentioned earlier, which is the Adapter Oral Health Clinic. I do believe, because I suspect a number of persons online are in that space, and they may feel more comfortable saying, listen, I want to adopt an oral health clinic and equip it and support it, because that's my thing. And when I come, that's where I want to practice, give back. I'm from Northern Clarendon, and that's where I want to give back. I'm from Manchester, wherever. That's normally a big driver for where people adopt. We're open to that. We're open to that. And I believe Mr. Cephas has said it. He'll work out that. So why don't we try to set ourselves a target of 10 or 12 over the next year, one a month, by asking the diaspora to look at adopting an oral health clinic. How does that sound?
Yeah, 100%.
All right. So I have placed 4 specific asks on the table, but there are other things that clearly you can get involved in. And from that reason, from that perspective, I think we can build and strengthen the partnership. Steve, anybody has any burning issue there or not really? Just okay? Okay, all right. So having said that, I think that's pretty much it. We have used up the time. It's now 8:15, so we did say 2 hours. We've done it in 1 hour and 45 minutes, which I think is good. I want to take the opportunity to thank those who have come online, thank those of you in the audience. I know you have had a busy day. You have been at this for all day with a few emergency run out of the building with a shaking building. I'm happy you're all okay. And I think October as Oral Health Month has served a lot of useful purpose in terms of the knowledge, the discussion, even the controversy that emanated from some of from the comments that I made. I think it's always good to have a space for clarity and for discussion, and I'm always willing to do that. So thanks to the Ministry of Foreign Affairs and Foreign Trade, Ambassador Miller at the ministry, who is in charge of diaspora affairs, the minister, of course, who came on and spoke, the Ministry of Health team, led by Dr. McKenzie, Mr. Cephas, and Stephen, and the technical team who are here, who allowed us to stream live out into the diaspora world. Thank you very much. God bless you. And let's keep the discussion going.